Welcome to the January 2026 edition of From the Desk of. As you may have noticed, I am not Erin Gertz, but I am the new Editor-in-Chief of ASH Clinical News. My name is Bethany Samuelson Bannow, and I'm delighted to step into the enormous shoes Dr. Gertz has left behind. Fortunately for all of us, his desk is still just down the hall, but I look forward to bringing my own perspective as the first classical hematologist to lead this incredible publication. The January issue of ASH Clinical News is always an exciting one, as this is when our on-location coverage from the ASH annual meeting appears in our print edition. In this issue, we feature 7 pages of the best information to come out of the annual meeting, with topics spanning classical and malignant hematology, including bleeding and clotting disorders, hemoglobinopathies, lymphomas, multiple myeloma, and more. However, before we jump into the meat of on-location coverage, we open the issue in viewpoints where, as is our New Year's tradition, the editor-in-chief, that's me, attempts to set the tone for the upcoming year in the editor's corner. In this issue, I attempt, without becoming overly philosophical, to talk about what it means to begin with the end in mind, and share a bit of my vision for the next few years at ASH Clinical News, including a few changes you can expect to see develop over time. In education, Dr. Sarah Rutherford takes on a tough case of refractory classical Hodgkin lymphoma in a patient with a long history of corticosteroid use, outlining potential therapies which may be offered to such patients. This month's Spotlight feature is sadly becoming more and more relevant. It highlights the role of patient support programs for patients struggling to navigate financial toxicity when medical expenses put treatment out of reach. We discuss the various types of assistance programs, including those funded by pharmaceutical companies, nonprofit foundations, and those dedicated to navigating the system, in addition to providing copay assistance or free products. We also tell the story of Mr. David Gale, a myeloma survivor and recipient of patient support who, while covered by Medicare, still found copays for drugs like lenalidomide financially out of reach. We close the feature with a discussion of anticipated changes with newly negotiated Medicare drug prices and the role of the hematologist in assisting patients with finding and accessing these important programs. In our news section, we cover the results of several exciting new trials, as well as new consensus recommendations on the diagnosis and management of AML in pediatric patients, all published in ASH's Blood Journal series. We also offer 2 insightful perspective pieces from Dr. Seethal Jacob on opioid timeliness in the emergency department and hospitalizations for acute sickle cell pain, and by Dr. Ryan Cassidy on the Alliance Study Cohort 1 results, examining inotuzumab, azogomycin, then blinatumomab for older adults with newly diagnosed B-cell ALL. In ASH Directions, we highlight some of the recipients of ASH annual awards. Then, in Society pages, reflect on the remarkable life of Dr. Alan Schechter, a legendary example of the power of connection and passion for hematology across his 6-decade-long career at the NIH. Thank you for joining us at ASH Clinical News at the start of this exciting new year. I look forward to seeing you in the pages for many issues to come. I'm Bethany Samuelson Bannow, encouraging you, as always, to stay curious, stay informed, and stay inspired.